Hi guys, I'm Dr. Koziarski here in Erie, Pennsylvania. We're going to go over a lot of the treatment conditions and modalities we use for our shockwave, piezo-wave shockwave treatment. The great thing is we don't need any needles, no surgeries. So we see a lot of people that, hey, this is my last resort, I don't want surgery. Or a lot of people have had failed surgeries or tons of injections and stuff like that, and they're like, I've had it. There's got to be a more conservative care modality for me. I don't want to be taking Mobic for the rest of my life for my pain and irritation. We'll start up here. A lot of the stuff we see is our thumb, our tenosynovitis, or a lot of our basal joint issues we can use the piezo wave for. A lot of our carpal tunnel. I see a ton of failed carpal tunnel surgeries in here. A lot of trigger fingers that we treat up in here. A lot of hand arthritis. I treat a lot of truck drivers actually. They sit there and they grip that steering wheel for 8 to 12 hours a day. And so they're just so stiff and achy in there. And so we get a lot of good results with that. We work our way up here. We get a lot of what we call golfer's, or not golfer's elbow, or lateral epicondylitis, also known as our tennis elbow. We get the irritation of that lateral epicondyle, all those extensor tendons up in here. We work a lot of that. We flip over here on the inside, which is your flexor tendons, and so we get a lot of that golfer's elbow, especially, well, it's winter now, but once the weather eventually will stop snowing in Erie, Pennsylvania, we'll get people out there playing golf, and we get a lot of that golfer's elbow or medial epicondylitis up in here. So we're just going to do a little brief overview today. We'll show you how simple and easy treatment is. Treatment's pretty much painless. It's more of an irritation in there. Remember, we're only focusing on that fibrosis-y tissue. That's what the cool thing about shockwave is healthy tissue is nice and organized, and those sound waves go right through it. We're just using acoustical sound waves. That disorganized tissue, those sound waves hit it, and it causes it to shear, and it causes a shear force, and that's that kind of yanking feeling you're feeling in there because it's shearing it up. If you were to go have carpal tunnel surgery, what they're going to do? They're going to slice here, they're going to open it up, they're going to take some scissors and a scalpel and cut all that fibrosis-y stuff out, sew it back up, and then put you in a brace for 8 weeks. And so we can go ahead and break that stuff up in there without having to do surgeries or anything. Simple. The name Shockwave sounds scary. It's really not. It's the same technology. They've been using this in Europe for 50 years. It's called lithotripsy is a common term. We use lithotripsy gel. Lithotripsy is what they use to break up kidney stones. Air is a poor conductor of sound waves, so we use some lithotripsy gel. Kayla doesn't really have an issue here, so we're not going to go too intensive on the treatment for her here. We'll just give you a brief overview of how kind of this treatment works out for those people scared or have seen the commercials at home and like, hey, I need a little bit more information on this kind of stuff. So I'm going to hit it to another one. Pretty much, so we find our treatment modality. It's we went and got trained, so we kind of know what we're kind of working with, what depth of penetration we need, how many shocks she needs for this treatment. But pretty much we find our treatment area that we want to hit, and it's a little bit loud. Hopefully you can still hear me, but this is pretty much our treatment modality. Is we're just kind of scanning over those areas where fibrosis-y tissue and irritation is, breaking that stuff up, making sure we're getting complete coverage of what we want. Again, she doesn't really have an issue. We're just using this as a demonstration purpose. But scar tissue, you feeling it in there? Mm-hmm. Yeah? So like keyboard typing, that's funny. Well, at least we know what to treat for Kayla now. So we'll work our way up here. We'll hit some fingers. How about up in here? Not too bad. We'll flip just a little bit. We'll hit thumb. Nothing. Great. Flip a little bit more. Actually, nope, other way. Tenosynovium here. Hit this thumb joint. Not too bad. Good. Palm up. All right there. It's that basal joint, huh? Too much texting on the phone. Hitting that basal, the base of the thumb joint in there. A little more up here in the carpal tunnel area. Yeah, treatment. Shockwave name sounds scary. It's really not that bad. It's just a matter of breaking that up. Getting that acute inflammation is what we want. Remember, acute inflammation is restorative. Chronic inflammation is degenerative. We want to flip that chronic back into acute and allow it to heal properly. All right, guys, that's our demonstration for today. Thank you.